I am Dr. Laura Moreno, and in this video, I want to talk to you about what happens when you drink coffee on an empty stomach, the good, the bad, and what you should know. Coffee is one of the most popular beverages in the world, and many people drink it first thing in the morning before eating anything. For some, it feels like a necessary ritual to wake up, get energized, or jumpstart the day. But drinking coffee on an empty stomach has effects that go beyond just feeling awake. Some of these effects are positive, some are neutral, and others can have consequences that you may not notice immediately. When you drink coffee without eating, the first system that reacts is your digestive system. Caffeine stimulates the production of gastric acid, which helps digest food when present. But when the stomach is empty, this acid has nothing to act on. This can lead to irritation of the stomach lining, bloating, discomfort, and even acid reflux in sensitive individuals. Over time, repeated exposure to excess acid in an empty stomach can exacerbate gastritis or make it more difficult for the stomach to maintain a healthy balance. The nervous system also responds strongly. Coffee blocks adenosine, a neurotransmitter that promotes relaxation and sleepiness. Drinking it on an empty stomach amplifies this effect because there is no food to slow down the absorption of caffeine. You may feel a rapid spike in alertness, energy, and focus. Some people experience a surge of motivation and enhanced cognitive function shortly after their first cup, and this is one of the reasons why many consider this routine effective for starting the day. However, the surge in energy can also trigger negative effects. Caffeine stimulates the release of adrenaline, the hormone responsible for the fight-or-flight response. On an empty stomach, this can lead to jitteriness, increased heart rate, restlessness, and even feelings of anxiety. Your body perceives a higher stress load because the combination of adrenaline and stomach acid can create a state of mild physiological stress. Blood sugar regulation is also affected. Drinking coffee on an empty stomach can cause a temporary increase in blood sugar levels because the adrenal response releases glucose into the bloodstream for immediate energy. For people with insulin sensitivity issues, prediabetes, or diabetes, this spike can be more pronounced and may contribute to energy crashes, irritability, or cravings later in the day. Even in healthy individuals, the pattern of energy peaks and dips can feel more dramatic when coffee is consumed without food. Hormonal responses are another important aspect. Cortisol, the primary stress hormone, naturally peaks in the morning. When you drink coffee on an empty stomach, you amplify this cortisol spike. While a moderate increase can enhance alertness and performance, chronic amplification may contribute to imbalanced stress responses, disrupted circadian rhythm, and feelings of fatigue or anxiety as the day progresses. Coffee on an empty stomach also affects your digestive motility. It stimulates bowel movements in many people, which can feel convenient, but relying on coffee to trigger digestion can create dependence over time. The stomach and intestines may become accustomed to this external stimulus, and natural rhythms may be disrupted. Additionally, some people experience nausea, cramping, or urgent bowel movements, which are signs that the body is reacting to stimulation without proper buffering from food. There are also subtle effects on hydration. Coffee is a mild diuretic, meaning it increases urine output slightly. Drinking it without water or food can contribute to mild dehydration, which can cause headaches, fatigue, and reduced cognitive performance. Over time, this can subtly impact energy levels and focus throughout the day. Mental clarity and mood are influenced as well. Some people feel sharper, more awake, and more motivated after coffee on an empty stomach. Others may notice increased irritability, impatience, or a feeling of being on edge. The difference largely depends on individual sensitivity, tolerance, and the timing of consumption relative to natural hormonal cycles. The gut microbiome can also be affected. Caffeine and other compounds in coffee interact with gut bacteria. In some people, these interactions can be beneficial, supporting digestion and microbial diversity. In others, especially with frequent coffee consumption on an empty stomach, it can increase intestinal irritation, inflammation or dysbiosis, which may affect long-term digestive health. Nutrient absorption is another factor to consider. Drinking coffee without food can interfere with the absorption of minerals like iron, magnesium, and calcium. Over time, if your diet is marginal in these nutrients, daily coffee on an empty stomach may contribute to subtle deficiencies, which could manifest as fatigue, muscle cramps, or decreased resilience. The adrenal system is heavily influenced by this habit. Constant stimulation first thing in the morning trains your body to rely on external stimulation for wakefulness rather than its natural energy rhythm. This may create cycles of dependency where you feel unable to function properly without your morning coffee, even if your baseline energy would otherwise be sufficient after proper rest and nutrition. Sleep patterns can be indirectly affected too. Even though drinking coffee in the morning seems far from bedtime, the hormonal and nervous system activation can shift circadian rhythms slightly, especially if coffee is consumed in large amounts or with high sensitivity to caffeine. Over time, this can subtly affect sleep quality, mood, and daytime energy balance. On the other hand, there are potential benefits. Drinking coffee on an empty stomach can accelerate metabolism temporarily, enhance short-term alertness, and stimulate digestive motility. For some people, these effects can be experienced as a natural kickstart to the day. The antioxidants in coffee also provide protective effects for cells, reduce inflammation, and may support long-term health when consumed in moderation. The key to benefiting from coffee without experiencing negative effects lies in understanding timing, dosage, and your own body's response. Drinking small to moderate amounts, pairing it with a light breakfast, staying hydrated, and being aware of your tolerance can help maximize benefits while minimizing risks. Observing your body's signals, such as digestive comfort, energy patterns, mood, and heart rate, is essential for using coffee in a conscious and healthy way. Even the type of coffee matters. Dark roasts, light roasts, espresso, drip, or cold brew all have different acidities, caffeine content, and compound profiles. Some may be gentler on the stomach, while others may trigger stronger hormonal and digestive responses. Experimenting with the type and preparation method can help identify what works best for you, especially if you prefer drinking coffee on an empty stomach. Moderation is key. While 1 cup of coffee on an empty stomach may be fine for many people, multiple cups or very high doses can exacerbate negative effects. The cumulative impact on the adrenal system, digestive tract, and stress hormones can become significant if repeated daily over months or years. Your body is constantly signaling whether it tolerates this habit or if adjustments are needed. Paying attention to how you feel before and after drinking coffee is one of the most important strategies. If you notice heart palpitations, jitteriness, acid reflux, nausea, irritability, or energy crashes, these are signals that the body is experiencing overstimulation. Adjusting timing, reducing the amount, or pairing coffee with food can mitigate these effects while preserving the benefits. Listening to your body also helps distinguish between dependence and healthy use. If you wake up and cannot function without coffee, this indicates a level of dependency. If you feel alert, focused, and energized, it indicates that your system is using coffee as a supportive tool rather than a crutch. Recognizing this difference is essential for long-term health and maintaining natural energy rhythms. Another important consideration is the effect of coffee on your stress response when consumed on an empty stomach. Drinking coffee without food can heighten the body's perception of stress because caffeine increases cortisol and adrenaline levels. Cortisol naturally peaks in the morning to help you wake up, but adding caffeine on top of that peak can amplify the body's alert state. This can be beneficial in small amounts, making you feel more awake and focused. But chronic amplification can contribute to anxiety, tension, or difficulty managing stress later in the day. Your heart also responds to caffeine in ways that are subtle but significant. Even moderate amounts of caffeine can increase heart rate and temporarily raise blood pressure. When consumed on an empty stomach, these cardiovascular responses are stronger than when paired with food because food slows absorption and buffers stimulation. For people with sensitivity or pre-existing conditions, this can manifest as palpitations, a racing heart, or feelings of restlessness. Energy balance is another aspect affected. Drinking coffee on an empty stomach can temporarily suppress appetite, which may seem convenient, but over time it can disrupt natural hunger cues. Skipping meals or delaying eating because coffee suppresses appetite may result in energy crashes, cravings, and overeating later in the day. Your body may start associating energy with caffeine rather than actual nutrition, which can create an unhealthy cycle. The gastrointestinal system is particularly responsive. Coffee increases peristalsis, the movement of the intestines, which can lead to faster digestion and the urge to go to the bathroom. While this can help regulate bowel movements in some individuals, in others it can cause urgency, discomfort, or diarrhea. Over time, the gut may become dependent on this external stimulus, potentially altering normal digestive rhythms. Coffee also affects nutrient absorption. Compounds in coffee can interfere with the uptake of minerals such as iron, magnesium, and calcium. When coffee is consumed on an empty stomach, this interference may be more pronounced because there is no food matrix to slow digestion or dilute compounds that affect absorption. Over months or years, this could contribute to subtle deficiencies if your diet is not well balanced. The microbiome is another area impacted by coffee consumption. Coffee contains bioactive compounds that interact with gut bacteria. While moderate coffee intake can support microbial diversity, drinking coffee on an empty stomach may irritate sensitive intestinal linings, leading to inflammation or imbalance in some individuals. Paying attention to gut reactions such as bloating, gas, or discomfort is essential for understanding your tolerance. Your adrenal system is affected as well. Daily caffeine on an empty stomach trains the body to rely on external stimulation for wakefulness. This can interfere with natural energy rhythms, leading to cycles of dependency. People may feel unable to function without coffee, and over time, natural energy levels may decline, even when sleeping adequately. Mood regulation is influenced too. Coffee on an empty stomach can increase dopamine signaling in the brain, temporarily improving mood and motivation. However, excessive stimulation can also increase anxiety, irritability, and emotional reactivity. For some individuals, this creates a roller coaster effect where periods of alertness are followed by crashes and emotional lows. Another factor to consider is timing. Drinking coffee immediately upon waking, especially before any meal, may not be ideal for everyone. Waiting 30-60 minutes allows cortisol levels to peak naturally, preventing overstimulation and reducing dependency. Pairing coffee with food, even a small snack, can buffer acidity, support nutrient absorption, and stabilize blood sugar levels. Quality and preparation of coffee also matter. Cold brew, for example, tends to have lower acidity and may be gentler on an empty stomach. Espresso or dark roasts can be more intense, potentially causing more pronounced effects on digestion and the nervous system. Understanding your body's response to different types and brewing methods is key to using coffee wisely. Moderation is the overarching principle. One small cup of coffee on an empty stomach may enhance alertness, support digestion, and provide antioxidants without causing negative effects. 2 or more cups, especially in sensitive individuals, can amplify adverse effects such as gastrointestinal irritation, palpitations, anxiety, or disrupted energy patterns. Listening to your body is crucial. Subtle signs like jitteriness, stomach discomfort, racing thoughts, or energy crashes indicate that adjustments are needed. These are not signs of weakness, but signals that your body is communicating its limits and needs. Awareness allows you to adjust timing, dose, or pairing with food to maintain benefits while minimizing risks. Using coffee intentionally rather than automatically transforms it from a habit into a tool. Observing how you feel, planning consumption around meals and activity, and recognizing individual tolerance ensures that coffee supports your body rather than challenges it. A mindful approach allows you to enjoy coffee's stimulating antioxidant and metabolic effects without compromising digestive comfort, hormonal balance, or emotional stability. Another important consideration is the long-term impact on your adrenal and hormonal systems. When coffee is consumed regularly on an empty stomach, it repeatedly stimulates cortisol and adrenaline, which are part of the body's stress response. While occasional stimulation is normal and can even be beneficial, chronic activation can gradually affect your circadian rhythm, energy patterns, and overall resilience. You may notice that mornings feel sluggish without coffee, or that stress feels amplified later in the day, even in situations that would normally feel manageable. Caffeine also affects your metabolic system. Drinking coffee on an empty stomach triggers the liver to release glucose into the bloodstream, providing a rapid energy boost. For healthy individuals, this is usually temporary and manageable. However, in people with insulin sensitivity or prediabetes, repeated spikes in blood sugar can contribute to insulin resistance over time, creating fluctuations in energy, mood, and appetite throughout the day. Pairing coffee with a small breakfast or snack can help stabilize these effects and reduce unwanted fluctuations. Your cardiovascular system is particularly sensitive to the effects of coffee on an empty stomach. Caffeine can transiently increase heart rate and blood pressure. In most healthy individuals, this is mild and not dangerous, but if palpitations, racing heartbeats, or dizziness occur, these are clear signs that your body is being overstimulated. Regular observation of how your cardiovascular system reacts is essential to maintain safety and well-being. Mental clarity and focus are strongly influenced by the timing and context of coffee consumption. On an empty stomach, caffeine is absorbed faster, producing a sharp rise in alertness. While this can improve concentration temporarily, it may also heighten anxiety, restlessness, or irritability, particularly in sensitive individuals. The rapid stimulation followed by a potential crash can leave you feeling mentally fatigued if not managed properly. Coffee also has important interactions with digestion. Drinking it without food can irritate the stomach lining, increase gastric acid, and stimulate the intestines. For some people, this is a positive effect, helping to regulate bowel movements. For others, it can trigger discomfort, cramping, or diarrhea. Over time, your gut may become dependent on this stimulation, making natural digestive rhythms less predictable without coffee. Nutrient absorption is affected as well. Compounds in coffee, such as tannins, can reduce the absorption of minerals like iron, magnesium, and calcium. When consumed on an empty stomach, the impact is often more pronounced because there is no food to buffer or slow down absorption. This can lead to subtle nutrient deficiencies if dietary intake is not sufficient. The microbiome also responds to daily coffee consumption. Coffee contains bioactive compounds that interact with gut bacteria, potentially supporting microbial diversity. However, consuming it on an empty stomach may increase the risk of intestinal irritation or imbalance in sensitive individuals. Paying attention to signs such as bloating, gas, or discomfort helps determine tolerance and frequency of consumption. Your relationship with hunger and energy may also shift. Coffee suppresses appetite temporarily, which can be convenient, but consistently delaying meals may disrupt natural hunger cues and energy regulation. This can lead to overeating later, cravings for high-sugar foods, or irregular energy patterns throughout the day. Observing these patterns helps in managing both nutrition and caffeine intake. Sleep patterns can be indirectly influenced even by morning coffee. Overstimulation early in the day can affect cortisol rhythms, subtly shifting circadian timing and potentially reducing sleep quality later. Even if you fall asleep easily at night, the depth and restorative quality of sleep may be compromised, leading to fatigue and a reliance on coffee the next morning. Mood and emotional regulation are closely tied to caffeine consumption. Moderate intake can improve motivation, alertness, and focus, while excessive or poorly timed intake can heighten anxiety, irritability, or sensitivity to stress. Individuals prone to emotional fluctuations should be particularly mindful of how coffee on an empty stomach influences their daily mood and stress management. Long-term habitual coffee consumption on an empty stomach can also create dependence. The body adapts to the stimulant effect, requiring more coffee to achieve the same level of alertness. When coffee is skipped, withdrawal symptoms such as headaches, fatigue, low mood, or difficulty concentrating may appear. Recognizing these signs allows for conscious adjustments to reduce reliance and restore natural energy rhythms. The type and preparation of coffee matter significantly. Cold brew is generally lower in acidity and easier on an empty stomach, while espresso or dark roasts can be more intense and potentially irritating. The brewing method, grind size, and bean quality all contribute to how the beverage affects your body. Experimenting with these factors helps tailor coffee consumption to your tolerance and comfort. Hydration should not be overlooked. Coffee is mildly diuretic, and without accompanying water or food, it may contribute to mild dehydration over time. Subtle dehydration can affect energy, cognitive performance, and even digestion. Incorporating water or a small snack with coffee can help maintain balance and support overall health. In summary, drinking coffee on an empty stomach has both benefits and potential drawbacks. It can increase alertness, enhance focus, and provide antioxidants that support long-term health. At the same time, it can stimulate stress hormones, irritate the stomach, affect blood sugar, and subtly influence nutrient absorption. The effects vary widely between individuals depending on sensitivity, tolerance, genetics, and overall health. The key is awareness. Observing how your body responds, your energy levels, digestion, mood, and sleep allows you to make conscious choices rather than following habit alone. Pairing coffee with food, moderating intake, choosing the right type and preparation, and listening to your body are all strategies to maximize benefits and minimize risks. Coffee is a tool, not a necessity. When used intentionally and mindfully, it can support your daily routine and well-being. When used without awareness, it can mask fatigue, disrupt natural rhythms, and create dependence. By understanding how coffee interacts with your body, especially on an empty stomach, you gain control over your health, energy, and overall balance, making choices that truly support your long-term vitality.